This disease is one that really, I don't know why, but this is one of them that really pulls my heartstrings. Yes, even I still have a heart, and it's still stuff can get to me. I'm not that jaded. What we see here, what is referred to as Staphylococcal Scalded Skin Syndrome, SSSS, 4S's, is what is referred to as a dermolytic condition. Dermolytic. Lytic means killing, dermo means dermis. The dermal layer is killed. This can happen pretty much in all ages. In children and us adults, it's going to be more of a region of the skin. Starts off as an area, usually about 2 or 3 inch diameter area that will spread. May pop up in other places after the spread begins. That's usually how it goes. For infants, newborns, and infant babies, what you're going to see is it's going to start in an area, and then it is quickly going to spread over the entire body. You get what is referred to as bolus lesions. Okay, this is going to be an area raised red that spreads, increases in diameter, hourly, daily. And what is happening is the cells that connect the dermis to the epidermis, okay, because these are living cells connecting the two. Well, these cells die. So you literally have the dermal layer being ripped in half, as you see there at the bottom in the figure on the right. So that red, raised, angry, dried out skin, cracking skin look is because the skin is drying out and dying off. The hair follicles, the sweat glands there are disconnected. So no more sebum, no more sweat to keep everything nice and lubricated and pliable. So the skin will start to slough off. This one's a little eh. I've read different, but we're going to go with what the textbook says. The split occurs above what is referred to as the stratum basal. Okay, this is the basal layer of the dermis leading up to the epidermis. You see in the middle picture there, the circular one. This is an area under somebody's bicep going up into their armpit, or under their arm going up into their armpit. This is, about an area that covered by your hand. This will continue to spread as the bacteria spread, and unfortunately, their exfoliative toxin spreads even faster. What we see, though, with infants, more often than not with infants, what happens here is what starts off as a small lesion, a small area, the toxin gets in the bloodstream. The toxin within minutes is all throughout the body and is leading to death of that dermal epidermal layer. So as you see in the top right there, that infant is literally shedding all of its epidermis at once. Depending on how deep this goes, how many layers are being shed off at once, if it goes deep enough into the dermis, you could actually have nerves, sensory nerves, being exposed to the environment. Extremely painful. So that baby is now basically having its skin ripped off of it, as you can see by the different shades of red versus pink. The pink areas just haven't been pulled off of yet, haven't completely shed off yet. This is a person to person. Somebody touches the baby. One baby has the Staphylococcus aureus that has this phage that's giving it this new ability, and it's person to person transmission, transient. Unfortunately, though, while it's transient here today, gone tomorrow on most people, most babies, there's going to be a few people that it just affects more. And thus you end up with the scalded skin syndrome. Due to sampling, they theorize, they did the calculations, they think about 30% of us adults are asymptomatic carriers. We have it on us. You have it on your skin, your nasopharynx. The nasopharynx, for those of you who don't remember your A and P, it's where the sinuses begin that turn down to go to the throat, down to the lungs. That's the nasopharynx. Perineum, that's between, that's down in the groin, the vagina, all of those areas. So we have it on us. Diagnosis, going to be clinical signs and symptoms. When you see that big red, and on an adult, you see that red raised area that's drying out, cracking, look like it's about to start to slough off, and it's spreading, getting bigger. Scalded skin. When you see a baby that's suddenly turning, within a day or so, is turned red head to toe, and the skin's drying out, starting to crack, look like it's peeling from like a bad sunburn. There you go. For infants, basically swap out, find out who's the carriers, exclude them from contact. Lots of PPE. Okay, no skin-to-skin contact for a while. Keep everything as sterile and as disinfected as possible. Begin treatment with antibiotics for whoever it is. Here's the problem with that treatment, though. The antibiotics, whether it's in an adult or an infant, will get rid of the infection within a day or two, within a couple of days. The problem is twofold. One, the damage has already been done. The damage was done today, and you're not going to see the effects of it for another day or two as the skin slowly starts to die and starts to peel. So that pain and all that symptoms are still going to continue on. The second thing with antibiotic use, antibiotics have nothing to do with the toxins, okay? That exfoliative toxin is still going to be floating around in the bloodstream of that infant for another day or two. So it's going to be another day or two after that toxin has been removed from the bloodstream for the end of the damage to be done. And then you're going to see a few days after that for the healing process to begin. And in all that time, you're going to still see the peeling and the sloughing off of the skin. The infant's still going to be in pain due to exposed nerves, and the chances of a secondary bacterial infection is still going to be quite high until the new epidermis can be grown.